So as a headache specialist, this is so important to weigh in on because I don't order imaging for all my migraine patients. However, if there's something unusual or like a red flag symptom, then I consider imaging. So this is one of the situations where I would consider imaging. So she's 27 years old. She's never had headaches. And if she all of a sudden starts getting headaches and they're also progressively getting worse and they're really terrible, then I would definitely order imaging, which would show, in this case, a glioblastoma or a tumor. So that is something on the back of all headache specialists' minds when someone has a new onset headache, is to rule out the scary things. Signs that I would order imaging for would be after age 50. There's something called giant cell arteriitis or temporal arteriitis. I want to rule that out. If someone has rapid headache within a few weeks, like I mentioned, if someone has a headache that has any focal neurological deficits like vision issues, weakness, numbness, I would order it in that situation. If someone has had a headache for a long time, but they start developing a really different headache, that would be something else I would consider for. I would consider imaging would be postpartum, especially after pregnancy or even during pregnancy, because pregnancy does make your blood thicker and hypercoagulable. So I'd be worried about a clot or anything like that. However, some patients just have worse headaches during pregnancy. But these are all things that go through our head, and there's a couple other situations, but these are some of the main ones.